My dear students, today we will discuss about the Cribriform fascia. So in this topic, we will be learning what is Cribriform fascia, where is it located, and what are all the structures that will be passing through it. The questions that you have to answer at the end of this session are: what is the meaning of Cribriform fascia or Cribriform? What do you mean by Cribriform? Then what is Cribriform fascia? And before learning that, what are the anatomical structures with the name Cribriform? Where do you find Cribriform fascia? What is this Cribriform fascia? Is it a modification of fascia? If so, modification of which fascia? What are the structures that gives the Cribriform fascia? And what is the clinical importance of Cribriform fascia? The word Cribriform is derived from Latin, which means sieve-like. Cribriform means sieve-like. It's an anatomical structure pierced by numerous small holes is Cribriform fascia. And what are all the anatomical structures that get the name Cribriform? There is what is known as Cribriform plate of ethmoid bone, which forms the roof of the nasal cavity, and it has several holes through which passes the phyla olfactoria. Then the other one is the present topic, that is the Cribriform fascia in the thigh. So we will be talking about the Cribriform fascia in the anterior aspect or front of thigh. Look at this diagram. This is the front of thigh, where we are seeing the deep fascia of thigh is called the fascia lata, and you are seeing a oval opening which is known as the saphenous opening. Over the saphenous opening, you are seeing the Cribriform fascia with several holes in it. And Cribriform fascia is also known as Hasselbalch's fascia. It's also known as Hasselbalch's fascia, and we can define Cribriform fascia as the perforated thin deep fascia covering the saphenous opening on the front of thigh. So Cribriform fascia is also known as Hasselbalch's fascia, and it is the perforated thin deep fascia covering the saphenous opening in the thigh. Where from it has got its name? It has got its name because of its sieve-like appearance due to perforations caused by veins, arteries, and lymphatics on their way to deep aspect of thigh. So because of perforations that are caused by veins, arteries, and lymphatics that are passing through the fascia to the deep aspect of thigh, it is sieve-like, and because of its sieve-like appearance, it has got the name Cribriform fascia. And then, now let us Look at the structures piercing the several holes in the cribriform fascia. One is great saphenous vein. We are seeing the great saphenous vein passing through the saphenous opening by piercing the cribriform fascia and joining with the femoral vein. This is the important structure that is piercing the cribriform fascia. The other structures that are piercing it are the superficial external pudendal artery, superficial circumflex iliac artery, and the superficial epigastric artery, and a twig from the medial femoral cutaneous nerve. So, the structures piercing the cribriform fascia are the great saphenous vein, superficial external pudendal artery, superficial circumflex iliac artery, superficial epigastric artery, and a twig from the medial femoral cutaneous nerve, and few lymph vessels. These are the structures that are piercing the cribriform fascia. Regarding the great saphenous vein, we can see it curving round the lower margin of the saphenous opening and piercing the cribriform fascia to end in the femoral vein. You can see the great saphenous vein joining the femoral vein. What is the clinical importance of cribriform fascia? The cribriform fascia is used in preventing the formation of new vessels in post-operative cases of surgery at the saphenofemoral junction to prevent recurrence of varicose veins. It works as an anatomical barrier. You have seen the saphenofemoral junction where the great saphenous vein joins the femoral vein. So, in cases of varicose veins, surgeries will be performed at the saphenofemoral junction. After the surgery, there are chances of formation of new vessels and recurrence of varicose veins. So, the cribriform fascia prevents the formation of new vessels. Hence, it works as an anatomical barrier. Now, you have to answer for the questions that were put forth before discussing the topic on cribriform fascia. So, take down these questions. Prepare the answers on a paper, scan them and submit as assignment. Thank you.